This is Columbia Morning on News Talk 1400 KFRU, and we're going to talk about something that goes by the acronym MOCPAP, and I'm going to say that's MOCPAP, Missouri Child Psychiatry Access Project. One behind this is Dr. Laine YoungWalker, and she was our guest a few weeks ago or maybe a few months ago, and we were talking about something else. I'm not going to confuse what we're talking about now with talking about that, but Doctor, welcome back. How are you today?
Thank you. I'm doing well.
This is your baby? This is something you started?
Yes, myself with a team of others. We were feeling the need.
So how many years ago did you do this, or how long ago?
So it was about 3 years ago that a group came together, and we started meetings called the Behavioral Health Pediatric Task Force.
So what did you have in mind? What did you hope would happen?
We wanted, number one, to have a program like Massachusetts had, the MOCPAP program. We wanted, number two, to have something like ECHO. And both of those things, we wanted to support primary care providers in their treatment of mental health.
So let's take a real live situation. Let's say that somebody in Northwest Missouri goes to see a primary care physician, and this is a person who's 9 years old and having some kind of what problems would play into or activate what MOCPAP is.
So they could be having excessive anxiety or sadness, depression, or they could be having learning difficulties and hyperactivity. So several things could be going on.
And so what the primary care physician who has looked at this, a pediatrician who has looked at this child since birth perhaps, would see, the physician, she might call a line and say, I've got a situation here that I just want to check to see whether I'm reading this right or whether I may be getting ready to say this to this patient. Can you confirm that I'm on the right track? Would that be an example?
Exactly. And so the child psychiatrist might need some additional information. They could help with diagnosis if there was question about that. They also can help with treatment and assessment.
So Dr. Laine YoungWalker, you got this idea. You worked with the team. Wendy L. is in the studio with me. You're the executive director of this program statewide?
We will eventually be statewide. Right now, we began implementation in the St. Louis 7-county Eastern region 1 year ago today.
Yes, we pointed that out. It was July 9th of 2018 when the phone line went live in the Eastern region.
Correct. And then in the 8-county Central region, we went live with our services April 1, and we will take this program statewide next year.
So do you have to enlist primary care physicians that will participate in this? What is the process? Or do you put it out there and anyone can call, or do they let you know ahead of time that they may be using this?
Yes, there is a brief enrollment process, very brief, just so that we can kind of track providers over time and their baseline knowledge as that improves. So we do surveys for providers, but anyone is available, is able to enroll in this project and participate, primary care providers.
Now, Doctor, you are a professor of psychiatry at the university and chief of child and adolescent psychiatry division chief. What is the University of Missouri's role in this?
So the University of Missouri really took charge in being the applicant for the money from Missouri Foundation for Health, and then being able to pull everybody together so that we could move forward. So as the primary investigator, I'm really overseeing the entire project, our evaluation component, our program component, making sure that we are meeting the needs of our community, but also having good values that are coming out of it.
I'm going to guess that maybe at the start of this you had certain expectations as far as maybe numbers and participation. Have they met that expectation?
So I'll say exceeded. Initially our plan was, we'll work on this for 3 years, get some data, get some funding, go statewide in the future. And so our numbers of enrolled providers have exceeded what we said we would do, and our going statewide plan has exceeded what we said.
One thing I was interested in is I was looking at some of the numbers that you have done. I don't know how recent this presentation was, but I think it was fairly recent. The Eastern region, 113 pediatric primary care providers signed up early on, 7 in the Central region. What's the problem with the Central region here?
Well, I think that was maybe a month or two ago, because we are now at nearly 150 providers in the Eastern region and about 40 in the Central region. And we are more rural here in the Central region, so our expectations were not the same as that Eastern region.
And we've been enrolling providers in the Eastern region since March of last year. We just started enrolling in the Central region.
Good point. One of the other things that I've seen, I said this off the air, was The population of under 18-year-olds in the state of Missouri is around 1.4 million. The number of child psychiatrists is 146. And I think you've done the math for me here. 11 child psychiatrists per 100,000 children. That is really not very many.
There's not enough child psychiatrists to meet mental health needs for children, and so there has to be other venues that we use. The primary care provider, whether they be a nurse practitioner, family medicine doc, pediatrician, is the front line. That's who they see. And so we have to equip them and help them to support these kids.
Right.
It's interesting because many counties, especially some right around here, Boone County, you've got listed, has 30 child and adolescent psychiatrists. So we are one of the ones in either central and east with a high number, but there are many counties that are adjacent to Boone County that have no child psychiatrists.
Exactly. I mean, and we're more of an urban place with a training program, which is why a lot of people train here and they stay. It's important to be able to mobilize those people to those counties where there is none.
So speak, if you would, and again, Wendy L. is the executive director of this here. Speak of the help to raise the awareness of this in a situation where, you know, when I grew up, and I grew up in a rural county, I think there would have been a certain attitude towards seeing a psychiatrist, and that may still exist, even though that was a long time ago.
Yes.
So using primary care physicians helps
Yes.
with the stigma in some way.
Absolutely. Primary care setting is where most families receive their mental health care. In fact, 75% of that care is delivered in the primary care setting. And most families would prefer to receive that care with their pediatrician or their general practitioner than have to be referred to specialty care.
So this helps you do that because, again, when a primary care physician makes a call, then they're calling one of the child psychiatrists that is, are they just waiting for calls, or help me understand
We're
what that
working
process
with
is like.
we're working with Behavioral Health Response out of St. Louis, and they have a 1-800 call center that's open 24 hours a day. They are the call center. The calls all go to them. And then we have a child psychiatrist identified for each day of the week, that day is their day, and they're available that day, all day, to cover calls. So providers may call and say, I want someone now, or in 30 minutes, or at 4 o'clock. They can specifically say when they want to talk to somebody. And that call center is one piece. The other pieces are linking them to resources, getting them to the therapy they need, and educating them on diagnostic abilities.
Are sometimes the calls made with the young patient in the room with the primary care physician, or is this primary care physician says, you know, excuse me for a moment, I'll be back in a minute?
Usually they're made with the primary care provider alone. We are going to implement a telehealth component where there are challenging cases that you could have the child in the room with the primary care provider. That is in the future, though.
I see the average age of the youth being consulted, 12 and a half years, 30% are 10 and under, 18% are 7 and under.
Yes.
So people might be listening and saying, what in the world are their, what are the diagnoses? Well, I was looking at that also. ADHD,
Yes.
anxiety, and depression are the top 3.
Yes, they are.
Even as young as 7 and under?
Yes. I mean, Joan Luby out of St. Louis WashU has seen preschool depression, honestly, to some degree. And so not all of it has to be medicated. There are other things that you can do to treat depression, anxiety. But when medication is needed, we want to support the primary care provider.
So what kind of feedback do you get from parents?
Overwhelmingly, we've had positive response from families who've participated. Care coordination is a component that we just implemented, and we've had our first families successfully connected to mental health treatment and are attending appointments, and we're getting great feedback from families that have participated.
So what I'll ask each of you, and let me start with the executive director of, again, this is the Missouri Child Psychiatry Access Project. It goes by Mo CPAP. So what people who are listening right now, I think we should feel better, those of us who do not have children who may be this, but what do you want people to feel about this? What would you like for people to say, oh, I'm so glad this exists? What else?
So many primary care providers would have referred to psychiatry in the past without this program, and that increased wait times, transportation issues. So with this program, they're able to stay in that primary care setting and maybe initiate treatment much quicker than they would have without this program.
And sometimes I would imagine if you could take care of it pretty early, you don't even have to go to long treatment process.
Yes.
But you're right. I mean, we talked about the lack of child psychiatrists throughout the state, so that would make it very difficult, and some would have to travel a long ways to be able to do that. And Doctor, I'll let you finish up also. What are people hearing when they hear this? What do you say, this is valuable because?
Well, I think one of the things it does is help to kind of open up discussion about mental health issues in a venue where parents and children are more likely to receive it. So it reduces some of that stigma. And so the primary care provider can say, you know, some kids have a lot of anxiety that can't be managed outside of medication. And so these are some things we can try. So reduce stigma, increased access, all those things are important.
I think all of us should care about that because, I mean, if this is a problem like I think the numbers show that it is, then we want young people to get a fair start. And
Yes.
sometimes mental health issues need that kind of attention. If I were taking my child to a pediatrician, do I ask the pediatrician, the primary care physician, do you know about this?
So
Are you involved in this?
We've had conversations about that, and I think it would be great if families knew about it so they could advocate for it. We don't want a primary care provider to feel pushed,
Right.
That they have to do something.
Very good. Well, thank you both for coming in today and for what you're doing. Wendy L., who's the executive director of the MO-CPAP, Missouri Child Psychiatry Access Project, which was originated in this state by Dr. Laine YoungWalker. Thank you both. Appreciate it.
Thank you.
It's News Talk 1400 KFRU.